I would love to welcome our guest presenter, Dr. Gloria Puurveen. Um, Gloria is project manager and knowledge translation lead with the I Nav-CARE project out of the University of Victoria.
Thank you so much for that kind introduction, Carrie. And thanks to all of you in Zoom land for joining me today. I would like to acknowledge my project team as well. That's Madison Smith, Barb Pessett, and Kelly Ashford. We're actually located at the University of British Columbia on the Okanagan campus. This work is a collective teamwork and not just done by me. So a little bit more about me. I grew up in southern Alberta on Treaty 7 lands of the Blackfoot, Stoney, Tsuut'ina, and Métis people. Currently, I'm located just a couple blocks up the hill from the Alzheimer's Society of BC's main office. These places carry the histories, traditions, and knowledge of many Indigenous peoples whose enduring connection to this land provokes me to commit to ongoing work in decolonizing my work practices and relationships. As I lead a project related to compassionate communities, something that is already deeply embedded in Indigenous ways of being, I am becoming more mindful of what it means to be with one another in community, especially as it relates to reciprocity and nurturing each other and all our relations. I'm also thinking deeply about the power of story and how, as Harold R. Johnson writes, we are all part of a shared story. So thank you so much for taking the time to be here today and becoming part of my story, and to the Alzheimer's Society of BC for inviting me to become part of your story. So in keeping with the story, I'm gonna start and launch us off in a story. So this is a story about Artura. She's 78 years old and is living at home in a small rural community with her husband, Aleko, of 55 years. Their children live out of province, but they have regular contact, and the kids come to visit about once a year. Over the past 8 years, Artura has been caring for Aleko, who is now in late stages of Alzheimer's disease. They've experienced shrinking social circles and networks of support as they get older and walk the dementia journey together. And while their love, commitment, and joy they have in each other knows no bounds, Artura concedes that daily life has become tough. She struggles with her own health, trying to manage diabetes, and she is becoming increasingly frail. She tells me that she's becoming ready to explore options such as home care or respite, and even long-term care for Aleko, something to which he has agreed to. However, before any of that can be organized, she has a fall at home and she's hospitalized. Aleko is hospitalized along with her, and as you could imagine at that time and in the chaos of that moment, there were no available resources to support him at home or in long-term respite. And while in hospital, Aleko's health takes a sudden turn, and he dies in hospital. Artura comes home alone, feeling without purpose, worried about how she's going to manage with reduced mobility and energy. She feels horribly guilty, wondering if she could have done more to help Aleko and to get formal services in place before a crisis happened. And as you could well imagine, she is grieving deeply. There are many points along Artura and Aleko's journey where a skilled volunteer could really make a difference, providing support, helping them navigate resources, and supporting them to age in place and live well or as best they can to the end of life. In the words of a person with declining health, and it's on the screen here, who's participated in the program a few years ago, she says, "I Nav-CARE is focused on the living the best you can with whatever you've got each day of the year. So in this presentation, I'm going to share with you the story of this volunteer program called I Nav-CARE. And to do that, I'm going to share with you some of what I Nav-CARE is all about, the research evidence that has been generated over the years, and then I'll share with you some new developments related to training volunteers to support people living with dementia. So what is I Nav-CARE? It is an acronym. I Nav-CARE stands for Navigation, Connecting, Advocating, Resourcing, and Engaging. And as on the screen here, it says that I Nav-CARE program provides specially trained, mentored, and experienced volunteers to work with persons living with declining health and their families to improve their quality of life. The navigator role is not a new one. Healthcare navigators have been used for many, many years to help patients navigate the healthcare system. These are paid positions that act as links between the person and the system and coordinating those healthcare services. Volunteer navigators have a very different role. They help people to navigate the changes and needs that arise as they seek to live long and well within their homes, whatever that home might look like. Navigation is understood as working in collaboration with people, their family, and community to promote quality of life, access to resources, and community connections using a person centered and compassionate community approach. I'm just going to highlight what I mean by specially trained. Volunteers are provided with training in these areas with the purpose to negotiate the best fit between the needs of the person, their family, and community, and available resources. The purpose is also to promote quality of life, foster independence, and facilitate community connections. I won't go into details of this education, but I will talk a bit later about the training to support people living with dementia and their care partners. So, what do volunteers actually do? Well, it's a long term relationship where volunteers visit in the home every 1 to 2 weeks. They have time to develop relationships and enjoy special friendships with people that make both of their lives more meaningful. They assist with tasks that people might find difficult to navigate and help them to stay independent for as long as they wish. They connect people to the resources and supports in the community that might be of benefit, and they help with overcoming difficulties in accessing said resources. A huge part of the role is to listen as people grapple with decisions and try to make sense of their illness journey, and volunteers provide support and encouragement through that. And they also provide a safety net for those living at home alone and without family nearby. So these activities are grounded in 4 key principles undergirding this program. At the top here, it's the first is about providing early support to people living with declining health and journeying with the person and their family along their illness trajectory. The impetus for this program actually came from Hospice Palliative Care Organization in rural BC, who reflected that they connected with people way too late in their journey and wondered if there is a way that they could connect to folks earlier to support their journey in a more fulsome manner, so that then they could adopt a more palliative approach to care and working with people over a longer period of time. Second, on the right of your screen, many community-based organizations rely on the unpaid labor of volunteers. And so to nurture their volunteers, it's really important to offer volunteers some training opportunities to build their capacity to be able to sustain in this work. And the Nav-CARE program with its standardized training contributes to this, to building that capacity for the volunteers. Third, one thing we've learned in our research is that communities have resources that many people don't know about. So connecting people to relevant resources in their community is central to this program. You're going to hear me talk about that a lot through this presentation, and it might sound like a broken record, but it really is about that connecting to those available resources. Volunteers really learning deeply about what is available in their communities. And finally, on the left here, Nav-CARE was envisioned as a compassionate community intervention. And compassionate communities is about empowering individuals and communities to provide support for individuals and family going through tough times like serious illness, caregiving, end-of-life situations, and grief. It's about raising awareness, mobilizing individuals and community assets, and building social connection and capital within the community. And you might think, hey, this sounds a little bit like dementia-friendly environments or age-friendly environments as well. There's a lot of synergies between these larger movements about how you might mobilize the community to support one another within the community. So the question is, where is the program implemented? So NavCare has been implemented in organizations that have capacity to support volunteers. And this part is really important. Earlier, when I defined NavCare, I mentioned that volunteers are specially trained and mentored. And so this mentorship and support comes from organizations that have experience with volunteers, having the resources to provide volunteers ongoing training, having connections within their communities to link volunteers with persons in need, and then having someone in the organization that can nurture and support that volunteer person relationship. Originally, it was implemented primarily through hospice palliative care, and much of the origin story is located within those environments. In part, it's because those hospice palliative care societies have a really robust volunteer mandate. So that was a space that could really kind of test this idea of volunteer navigators. But as it grows across Canada, it's been taken up by other community-based services, such as organizations that support older adults. It's being implemented in health authorities and also in long-term care. And here is a map of where these organizations are located. And I'm sorry that it's a little bit kind of spread out in a weird way here on my screen. So um, over the years, we have spread to more than 50 organizations across Canada, and you can find the specific organizations who have a Nav-CARE program on our website. The volunteer coordinators or leads from these organizations are invited to participate in a community of practice where they can share their stories, successes, and challenges. And for me, this has been such a privilege to be part of, as folks from Newfoundland to Prince Rupert to the Yukon talk about the people they're working with, the vibrant communities they're part of, and how they rally to support people in need. It is from these communities that we've learned that volunteers want training to be able to better support people with dementia and their care partners. So this spread across Canada is this culmination of many, many years of collaborative research led by Dr. Barbara Pessett at UBC Okanagan and Dr. Wendy Duggleby from the University of Alberta. And, hence you can see where all this sort of clusters in BC and Alberta are from because they have such intimate connections within their own respective provinces. So Barb and Wendy have been working with local, provincial, and national knowledge partners with a vision to address barriers to care for those with living with declining health. And it certainly has been, ideas that have been nurtured and massaged back and forth between community partners and Barb and Wendy doing the research behind that. So a really sort of iterative evolution of Nav-CARE, starting from small beginnings to this larger spread across Canada. So I've been with the program since 2021, leading the implementation across the country, supported by a contribution from Health Canada. So that's in that 2020 to 2025 bubble, that scale up and sustain. And we're moving forward into this next phase of the research and scaling deep. And what that means is really trying to build interagency and interorganizational partnerships to work in collaboration with each other to really think about how we can implement compassionate communities effectively, as well as dementia inclusive communities, building upon much of the work that the dementia friendly movement has been doing. So the evidence has been building over the years and the various projects. I'm not going to go into this in too much detail, but various projects have collected quantitative and qualitative data evaluating programs' effectiveness from the perspective of organizations, of the volunteers, and persons living with declining health and their family. And if you're interested in the details of these studies, the majority of our studies are open access and you can access them again on our website. But I'll give you a little bit of a snapshot of the findings. So from an organization's perspective, while the training is standardized, how the program is implemented via the various tools in the Nav-CARE toolkit, this can be tailored to the community's context. So this is really important given that huge spread of the different organizations across the country. There's such a difference in rural versus urban versus remote environments, or places that are resource rich or very resource scarce, or the degree of interorganizational cooperation or competition, and so forth. And all of that will really impact an organization's capacity to implement any program. So we don't really give them, a very standardized way to implement. They can massage it to to their own community context and to their own community needs. What is standardized is the education. So, but that implementation is not standardized. Second, many of the organizations we work with have a mandate to support aging in place. That's including the hospice palliative care organizations. And this program has really enabled them to realize this mandate, and in part because volunteers supporting people in their homes can act as an extra set of eyes. And if they observe that a person with declining health is needing support beyond what they, the volunteer, can offer, with the consent of the person, the volunteer can alert the volunteer coordinator, who then can mobilize other services from either within their own organization or from other organizations. And indeed, in some organizations in the interior of BC, the coordinator participates in palliative care rounds, acting as that liaison between the person and the volunteer and that formal service. And finally, organizations have told us that the NAV-CARE program provides them a model for creating compassionate communities to build social connection and build social capital and help them sort of raise awareness of hospice, of palliative care, of dying, of death, and sort of trying to sort of quell some of the stigma that's around some of those things. So from the volunteer's perspective, through our quantitative data, volunteers tell us that they feel really well prepared and confident in their role. And importantly, the development of meaningful and reciprocal relationships are integral to their satisfaction in the role. And I want to tell a little story about a volunteer from rural Alberta who did not want to really support people who were at the end of life, but did want to volunteer with a hospice organization. He was a little bit kind of afraid of supporting somebody who is actively dying, and so the volunteer coordinator placed him with somebody who was just experiencing some mobility issues and some frailty, and that volunteer was providing some real practical helps. But he really started to develop a really meaningful relationship with that person, and as that person's illness journey sort of took some different turns, and as that person moved closer and closer to the end of their life, that volunteer stuck it out with him. And because that relationship was so meaningful to him. And after that person died, the volunteer stayed with the family to support them in their bereavement journey. So in this way, the volunteers talk about contributing to community. As another volunteer said, I think my favorite part is knowing that this can develop into a bigger picture of creating a healthier community. Many of the volunteers come to these programs having borne witness to other volunteers supporting maybe a parent or a friend, or they've been connected to a hospice society or a long-term care facility, and they want to give back to those organizations by volunteering with them. And so they really like that part of that part and their contribution to creating those, what this person says is a healthier community. And then finally, many volunteers are motivated to volunteer as it's an avenue for lifelong learning. And so if this is the NAV-CARE training provides them with a robust training package. They get a certificate in the end. There's lots of additional training opportunities and ongoing education opportunities through these organizations. And this is really fills their cup as people who are engaged and wanting to learn more. Then from the perspective of people living with declining health, again, our quantitative data across our studies have been showing significant improvements in people's awareness of available services. They show greater confidence in making decisions and taking care of their health, and greater confidence in communicating their needs, especially to healthcare providers. One of the roles that the volunteer does is help people, rehearse what they might want to say to a doctor or another care provider. And this has really helped folks being able to articulate their needs in more of a clearer way. The qualitative data uh, also offers a plethora of examples of how volunteers help them. I'm just going to I've organized these qualitative data according to the CARE acronym, so the connecting, advocating, resourcing, and engaging. So, in terms of connecting, here's a quote from a participant that just simply says that the volunteer makes her feel better, and that the volunteer has become a friend. So many people the volunteers interact with are lonely or are at risk for social isolation, and this volunteer is that person who just happens to make that person feel better. And that volunteer is just really nice to have around. In terms of advocacy, for this participant, the participant didn't want to her friend to take on this role, as she was concerned that it would to be too much of a burden for her friend. So having a volunteer to step into this role instead was really, really helpful for her. And the volunteers, there is, um, if you can harken back to an earlier slide, one of the main modules in our training is about advocacy and supporting volunteers to be advocates, but volunteers to support um, persons with declining health to be self-advocates as well. So in terms of resourcing and for this participant, the volunteers really alerted her to affordable housing that the participant didn't really realize was available in her community. And while at the moment the participant didn't really need to move, knowing that there was this option was hugely comforting. And I mentioned that we do talk about how volunteers can connect the persons with declining health to the different kinds of resources in their community. And one of the things that they learn how to do, and they do this as a group, is kind of like a physical environment survey, looking at the assets and gaps in resources within their community. And this being an ongoing thing, because as we all know, resources and services have such changeover over time. So you think that there's a service available here, and then a month later it's no longer in existence. And so the volunteers need to sort of be kind of on top of that. Then finally, in terms of the word engaging, there we have so many examples of volunteers supporting social and physical and cognitive and spiritual engagement. So for this person, the support to identify weekly goals, to get her to her appointments and exercise programs was integral to her quality of life. So now I'm just going to switch gears a little bit and talk about some exciting things that have been happening with the NAV-CARE program. So what I've just sort of shared with you is just kind of the general NAV-CARE program, where we have this curriculum for volunteers to support people with declining health, whatever that might look like. And so that could be, somebody living with dementia and their care partners, but it also could be somebody else. And so volunteers have talked about how, and organizations have talked about how they're starting to see more people with dementia and their care partners really needing some support from a volunteer, or could benefit from support from a volunteer. And so perhaps we could think about how we might adapt that NAV-CARE training program to train volunteers to support people with dementia. So this work was led by Madison Huggins at the University of British Columbia, the Okanagan. She has just defended her dissertation and is working on the final edits before she can make this available. And hopefully she'll have a publication out on this in the next few months. It will be open access, so it will be available to whoever's interested. So I'm presenting this on her behalf, so hopefully I'll do it justice. So Maddie's work was a two-phase project. The first phase was a modified e-Delphi study, and this is just a fancy way of saying that she was looking for consensus from experts in the field, including those with lived experience, on two questions. What are the needs of carers of persons with dementia? And what are the knowledge, skills, and abilities needed for volunteers to support carers? So, through this process of coming to consensus, there was a list of competencies that were developed, which formed the core content of the training curriculum. And this curriculum centered on volunteers' relational skills, understanding and supporting carers' well being, identifying and assisting with access to resources, and learning about dementia and learning about stigma. Sorry. This led to phase 2 of the study, which involved training of the volunteers, then matching them with care partners to receive volunteer support over a 6-month period. And this work happened in rural Alberta and in 2020 and 2023. And 17 volunteers were paired with 18 carers, and so they received that support over 6 months. So I'm just going to share a few of the findings from phase 2. Some of the findings are listed here. It was kind of clear that volunteers provided important emotional and relational support through problem solving, validating experiences, and providing encouragement. Maddie also brought, and I thought this was really, really important, Maddie brought careful attention to the active role of deep listening. So kind of like that quiet presence of bearing witness to somebody's journey. While some carers thought that they could rely on friends and families to just listen, for others, having an objective, non-family or non-friend person to talk to was so important. They didn't want their close relations to worry about them, and they didn't want to overwhelm them with their own feelings of being overwhelmed. So volunteers opened up that space to vent, to focus on their needs, to process their emotions, and to have someone follow up on topics they discussed. And through this, carers described feelings of being less alone, comforted, and reassured. Volunteers also provided important information and resources related to healthcare and the legal systems, for example, in Alberta, about powers of attorney. They also helped carers wade through a mass of information available. So I've been in this field since the early 90s, and still now, doing a simple Google search on dementia can be just so full on, right? Especially given that the first things now that are listed are generated by an AI bot, just so much, right? So volunteers are trained in how to support people in virtual navigation and a learning about how to distill junk science from evidence-based science. So then Maddie's findings also point to things that were not enough or overly clear in the training. So some carers felt that volunteers didn't know enough about dementia or the realities of caregiving. Volunteers and carers talked about the complexities involved in finding available, appropriate, affordable, and accessible resources and services. I suspect that many of you on this call can really attest to that. And then finally, the timing of the volunteer supports was seemed important. Like I mentioned, this was a really short pilot study, and carers were at various points on that dementia journey. And many carers spoke about how the service would have been useful for at diagnosis, or others envision how this service could be useful as they're moving into an end of life situation. So that timing piece was really important. With these findings, we have just completed, like literally today, we've just completed a curriculum revamp. So what we're doing is paying more attention to helping volunteers understand a relational view of dementia. We have learned that while the previous training that was focusing on supporting carers, we have learned that we also need to include training for volunteers to support persons living with dementia themselves, as the carers have really said, supporting them, supporting the person with dementia can support them, and vice versa. So we draw a lot of attention to person and relational centered care and strengths-based approaches, and helping volunteers to learn how they can elevate and accentuate capabilities of both the person with dementia and the care partners along that dementia journey. Framed in this way, also alongside talking about the different types and symptoms of dementia, helps foreground abilities, unique experiences, values, hopes, relationships, lived experiences, histories, and all that beautiful complexity of people living with dementia and their care partners. We've also brought more attention to quality of life concerns along the trajectory. An example of that is thinking about how stigma can shape people's experiences of being in this world from diagnosis to end of life, and then challenging volunteers how they can advocate to in the use of the action guide people who did the flipping stigma. So how volunteers can advocate to flip stigma on its ear. We've also paid careful attention to communication, really talking about how words matter, the use of person-centered language, and how to talk with carers and the person with dementia, giving space where both voices can be heard and held with care and attention. And also thinking about highlighting those behaviors as a form of communication and dispelling some of those myths around challenging behaviors. And finally, we've identified some of the challenges people with dementia experience in finding and accessing relevant services, and we've provided some strategies for volunteers to dig deep in learning more about the available services and determining if these would indeed align with people's needs. For example, a day program is available, but the wait list for it is just out of this world, and so it's not going to meet that need in that at that point in time. So throughout our curriculum, we have pointed the volunteers to other resources and best practices. For example, the Flipping Stigma Toolkit, the Behaviors and Dementia Toolkit, the abundance of resources from the Alzheimer's Society, and from the Schlegel Center and whatnot. And the purpose of that is to not reinvent the wheel, because these things are just so robust and beautiful already. And just like, and to acknowledge all that important work that everybody else has done. And so if volunteers were to just work through the words that we wrote, it would take them about 2 hours to work through that. But with all these other links and resources available, it would take them quite a long time to work through this training. And so we encourage organizations, when they take this up, to maybe do a continuing education workshop on flipping stigma, or some continuing education on behaviors and dementia and so forth, so that the volunteers can like come together and talk about this and truly get that the benefit of all these other really amazing resources. So we are really literally launching this new curriculum today. Um, Kelly Ashford, my colleague, has just crafted a newsletter announcement, and she's about to hit send this afternoon. So this is quite exciting for us. Um, the curriculum is going to be freely available to all our current NavCare sites. So those who have taken the NavCare training can just take that dementia module. And we ask that any new volunteer take the complete curriculum. And in part is because all those other bits and pieces of the curriculum really have a lot of relevance to the volunteer role as they support folks with dementia and their care partners. And but then we're also going to be piloting the curriculum and what we're calling a compassionate community. This sounds kind of clunky, but a compassionate community, dementia inclusive approach, piloting this idea that a volunteer support through those two lenses, and thinking about that and using that model in six sites across Canada. So in Ontario, it's the Bruce Peninsula Hospice. In BC, we're going to be working with Greater Trail Hospice, Prince George Palliative Care Hospice Society, and Brella Society in White Rock. and in Alberta, working with the Age-Friendly Cold Lake Society. So that's in northern Alberta. And these folks are amazing, taking a small community and making that community age-friendly and doing great things there. And then with the Yukon government, so with Yukon Health and their dementia strategies there. So that's some of our exciting and new directions, and I'm looking forward to being able to share some of those the learnings from the this pilot, and maybe we'll have um, research webinar 2.0 that I can share some of these learnings with you. Thank you from the bottom of my heart for listening, for being here today, and sharing in this conversation. And I also would like to thank the funders who have made this work possible over the years, particularly to Health Canada for their ongoing support in the rollout of the dementia curriculum and that dementia compassionate community dementia inclusive approach that we're hoping to take. So that's it for me, and I welcome the questions.
Gloria, thank you so much for this incredibly thoughtful presentation. I loved the way you weaved storytelling throughout, and really you bring so much compassion to the way you describe the evolution of the program, as well as sharing those stories and quotes. And also wanted to say a huge congratulations on the launch as well. Thank you for presenting today, given probably it's been quite a busy time to get to that launch. From here, I would love to pass things over to Sarah to help facilitate our Q&A. So please feel welcome to pop any questions in the chat, and we will ask those questions through Sarah as well. And we've got some links to some of those resources that Gloria did mention. And also, Michael has linked the helpful resources document, especially the I Nav-CARE website, where there's lots of links to check out as well. So with that, I'll hand it over to Sarah.
Thanks, Carrie. And so we've got some questions in the chat, but one that we've got that I would really be interested in hearing about, Gloria, is what is the criteria for matching volunteers with uh, people who are in need of additional support? How do you go about that?
Sure, that's a great question, and it looks different across different organizations, right? As you well imagine, each organization is unique. So so the process though has some sort of overarching kind of similarities. So a person with declining health or a person in need or their families, they'll either self-refer or they'll receive a referral from a healthcare provider or another community group. And then the volunteer coordinator would reach out to that person and sort of do kind of a bit of an intake, try to understand where they're at, what are their preferences, what are their things that they like to do, sort of kind of understand the unique stories of those people. And
Mhm.
then they'll try to match that with a volunteer who has similar interests uh, and uh, and ways of being in this world. I think that's really important to kind of match that. And then the volunteer coordinator and the volunteer will go to the person's place in many organizations. I don't think all of them, but in many organizations, they'll kind of do a little trial run, and if things look like it's going to be okay, then they just let them go off and do their thing, and then mentor and support them throughout that journey. Or they'll go, okay, so this is not a good match, and so we'll try something different. And then with that, sometimes people have greater needs than what one volunteer can offer.
Mhm.
And so that volunteer coordinators might place maybe 2 or 3 volunteers with that person so that there's this continuity of care, if you were. over a period of time so that the person feels supported from multiple people. Yeah.
It's wonderful. Thank you. Thank you for describing that. It sounds like there's a lot of thought that goes into pairing people together.
Yeah, and so it like these are volunteers that are going into people's homes, so
Hmm.
it could be kind of scary for volunteers, especially and for organizations that might not have a community-based volunteer program. They might have like a long-term care home has volunteers that come into the care home but not go out into the community. So it's a different way of interacting with people. So they are quite careful about that and
Hmm.
wanting it to be a good experience for the volunteer and for the person with declining health. Yeah,
Yeah,
thanks.
absolutely. Marilyn asks, do you have a location in the Okanagan, particularly in Kelowna?
Ooh, not in Kelowna specifically. There is the Central Okanagan Hospice Society. Yes, in Vernon has a program. So, and then also the Desert Valley Hospice Society, which covers Oliver. Oh my gosh. The Oliver Osoyos and one other little community there, but not in
Mhm.
Kelowna specifically. So, yeah.
Gloria, I can tell that you're really in it because you can name off the organizations depending on location. Okay.
I
Um,
reversed.
okay, Marilyn, I hope that answers your question. We have another one from Linda. Is there a wait list? Or is there a wait list to get a volunteer?
Oh, that's such a great question because this is something that every organization, whether it's a NAV-CARE program or not, any organization that has volunteers, there's this fine balance between having too many clients, not enough volunteers, or not enough too many volunteers and not enough clients. And so sometimes there is a wait list, but yeah, it really depends on that ebb and flow. And so organizations just they're so incredible in how they recruit volunteers and putting the word out there about looking for volunteers. And I imagine people who do volunteer will know about those kind of recruitment strategies. So sometimes there is, and I can't answer that question more fully than that.
I can appreciate the balance that, yeah,
Yeah.
that's required. Okay. Okay, we've got another question. Who who are you linked with in Victoria?
At the moment, nobody, but back in the earlier sort of iterations of NavCare, Comox Valley participated in some of the pilot studies. And so, though they might not have a NavCare program per se, I do believe that they still have a friendly visitor program, and that might have been built upon the NavCare program, which is okay, which is great too. They're filling an important need there, but nobody
Mhm.
in Victoria specifically.
Okay, thank you.
I feel like we're everywhere and then nowhere.
I
And no, we're not in Kelowna, no, we're not in Victoria. Oh gosh, sorry.
but that's okay. We've seen the map. You're in a lot of other places. Um, Mary has a question. Could a volunteer support someone with a disability who is well otherwise?
Yes, absolutely. Absolutely. I think one of the things that that's so important and about the program is that we all of us have needs in our lives when we might need the extra support from somebody, right? And that's
Mhm.
about the compassionate community. So we're all going to be touched by something, whether whatever it is, and then whether that's a disability. And so yes, a volunteer most certainly support that person. Yeah.
Wonderful. And I'm just wondering, how does NavCare or in sort of ensure or support those who are from ethnocultural minority groups? Is there any education around that, sensitivities that volunteers need to be aware of?
Yeah, that's a great question. So, um, the in our first module about what is the role of a volunteer navigator and some of the kind of conceptual pieces about being a volunteer. We talk about cultural humility, trauma informed care, and those pieces. But
Mm,
many of the organizations that implement the program have very specific training related to the communities that they're part of. So, our partners in northern BC, for example, have some real robust training on supporting persons in First Nations communities and what that might look like. So, um, it's hard. It's kind of this sort of fine line for us as a national program to kind of be very specific in these different things. So really leave it to the organizations to provide additional training in that, and that's part of the flexibility of this program is that they are most welcome to do that.
awesome.
Yeah.
Okay, thank you, Gloria. Another question for you, Gloria, and then maybe we'll wrap up the webinar. But I was wondering, what does compassionate communities mean to you? Um, we've heard that term several times, and so yeah, if you do you want to give it a go to define it? I know it's kind of a loaded question.
Yeah, no, it's not a loaded question at all. I think Uh, it's, when we come together as neighbors, as friends, as community members, as, just people just people in these, as citizens, there we go, there's the word,
Mm,
and come together to look and care for one another. And I think our communities can be much healthier if we truly banded together and looked out for one another. And I think, it's just like dementia inclusive environments does something very similar in that kind of mandate, where it's like we need to band together to promote the well-being of persons living with dementia and their care partners within our communities, and it needs to happen within the community. We don't need to expect just healthcare providers
mhm,
to doing that. We all have a responsibility because we all will be touched by something um, in our lives. And so there is a responsibility as citizens to be able to do that, and an honor as citizens to be able to do that for one another. And I think about as I learn more about Indigenous ways of being with one another, how integral that is to Indigenous ways of being with one another. And we can learn so much about that and bringing that into our daily practices. And so it's not just the connections and the compassion that we show for one another, but the earth that holds us and all the relations that are part of that. So I think that is that's it. That's what compassionate communities need.
uh, thank you, Gloria. That's a beautiful definition.
Oh,
Thank
thank
you.
you. And thank you for putting me on the spot.
Oh, sorry.
But I have thought a lot about it.
No, you clearly have. Thanks, Gloria. Um, And so, okay, so we've got a question from Theo. One more question.
Sure.
What resources would you recommend for caregivers providing assistance to persons with schizophrenia related dementia?
Oh, that's a good question, and I'm not sure if
Mm,
I can answer that really well, uh,
okay.
other than sort of pointing people in directions of the Alzheimer's Society
Mhm,
and these national bodies that support and put out really quality information about different forms of dementia, and including what could help caregivers in those kinds of very specific contexts. So I think the Alzheimer's Society of BC and of Canada would have a lot more expertise in that, and that's where I would direct somebody. So, yeah, thank you.
thank you. I would also echo that. Yes, please check the Alzheimer's Society websites, Theo, for resources.
Yeah,
So thank you, Gloria, and I'm just going to jump to some final slides, if that's
sure.
okay. If that's okay with
Absolutely.
you.
Thank you,
Okay.
everyone, for being here. Yes,
Thank you for being here. This has been such a wonderful webinar. Well, I'd like to thank Dr. Puurveen for taking the time to share these stories of connection and community with us. And thanks to you for joining in today. from near and far. We really hope that you enjoyed our Research Connects webinar. Um, we always love to hear from you. If you have any other questions or concerns about today's topic, please send us an email to research@alzheimersbc.org. And if you're wanting more information about dementia or wondering about programs and services that are offered through the Society, please give our First Link Dementia Helpline a call. Our operators can support you in English, Punjabi, Cantonese, and Mandarin. So, with that, we'd like to thank Gloria for sharing the wonderful and impactful work of NavCare. And thank you to all of you for joining us. We look forward to seeing you in January. And on behalf of the Research and Knowledge Mobilization team here at the Alzheimer's Society of BC, we wish you a very happy holiday season.